Immunotherapy is a process by which we try to retrain the immune system to be less interested in things that you're allergic to. The idea being is that you'll then have less symptoms if you come across that allergen. It's not a new treatment, it's been around for over 100 years, but particularly for hay fever, where there is an allergy to pollens. So what the treatment aims to do is to reduce how responsive your immune system is when it comes across pollen allergens, and as a result, reduce the symptoms of hay fever and reduce reliance on medication. There's been a lot more interest recently in immunotherapy for food allergy, because food allergy can have an enormous impact in quality of life. It's not really that food immunotherapy is used as a cure for a food allergy, but more to just reduce the likelihood of accidental reactions to small exposures, which can often happen just in day-to-day life. And the possibility of these can cause an enormous amount of anxiety, as it's difficult to predict how severe those allergic reactions might be. So with food immunotherapy, we use small but increasing doses of the food that the child is allergic to as a way of making them less sensitive to it. You could treat any food allergy with immunotherapy, but there's really only a lot of data and scientific studies behind desensitization treatments for milk, egg, and particularly peanuts. So in my practice, most children with milk and egg allergy will just outgrow it naturally, but we can speed things along by using immunotherapy. Or if after a few years they're not outgrowing it, that's when immunotherapy can find its place. For peanut allergy, unfortunately, there's less of a chance of just naturally outgrowing it. So immunotherapy is an option really right from diagnosis as a possibility for a treatment. It's difficult to predict exactly how long immunotherapy will take because it's individual for each different child. And actually there's lots of different ways of doing it. Some immunotherapy treatments will take just a few weeks, whereas others may take months. I think the important thing here is to remember that it's a marathon, not a sprint. It's more important to do it very safely and get a good outcome than it is to try and do it as quickly as possible. Food immunotherapy does carry a risk because you're deliberately putting the child in harm's way, giving them the thing that they're allergic to in order to make them less sensitive to it. So of course, the main risk is that there is a risk of allergic reactions on the exposures that the child has. The biggest risk is when you increase the amount of allergen for the first time. And so we would normally do this under direct medical supervision, so that if there is a more significant reaction, we're there to treat it effectively. However, many of the doses will be given at home. And so it's really important that parents are properly trained at how to recognize and manage allergic reactions as soon as they happen. One of the key things about the decision to progress with immunotherapy is balancing the risk between the possibility of having mild or sometimes more severe reactions, but in a managed situation because it's being done under as part of an organized program. But then as a result of doing that desensitization treatment, being much less likely to have an accidental reaction that could happen out in the community where there may not be the facilities to deal with it as effectively as quickly as possible. One of the really important things to understand about food immunotherapy is that it isn't a cure, certainly not for things such as peanut allergy, which are seldom naturally outgrown. If the treatment is stopped, the child will simply return back to their previous state of being allergic and be just as sensitive as they were before. But if the desensitization treatment is successful, if the treatment is continued, which essentially just means continuing the same dose of peanuts given at home on a regular basis, then that effect will be maintained. And there's good evidence that continuing the treatment for a long time can actually enhance the effect and make the child increasingly less sensitive to the food that they're allergic to.